This is the VOA Special English Health Report. The World Health Organization says the number of cases of tuberculosis has been falling since 2006. Also, fewer people are dying from TB. But a study by researchers at the University of California, San Francisco, says smoking could threaten this progress. Nearly 20% of all people use tobacco. The smoke also sickens millions of non-smokers. The new study predicts that smoking will produce an additional 34 million TB deaths by 2050. Efforts to control the spread of tuberculosis have mainly focused on finding and treating infections. Much less effort has been made to understand the causes. Dr. Anthony Fauci is director of the National Institute of Allergy and Infectious Diseases. He says more than 1 million people each year die from TB, and millions more get infected. It's still a very important problem. So we have to do the practical thing, and we have to do the fundamental research things at the same time. Smoking does not cause tuberculosis. Bacteria cause the infection. But the study says smoking affects the nervous system in a way that makes an inactive case of TB more likely to develop into an active one. Study co-author Stanton Glantz is director of the University of California's Center for Tobacco Control Research and Education. He says tobacco use could increase the number of people expected to die from tuberculosis between now and 2050 by about 26%. The study is described as the first to identify a direct link between tobacco use and rates of TB infection and death. Professor Glantz says the results should guide those creating health policies and TB control efforts. If you want to control the infectious disease of tuberculosis, you have to control the tobacco industry and the tobacco industry's efforts to increase tobacco use, particularly in developing countries where tuberculosis is a big problem. The study predicts that the situation will only get worse if tobacco companies continue to sell more of their products in those countries. It says strong efforts to control tobacco would not only reduce deaths from smoking-related diseases like emphysema, heart disease, and lung cancer. Those efforts would also prevent millions of deaths from tuberculosis. The study appeared in BMJ, the British Medical Journal. For VOA Special English, I'm Alex Villarreal. This is the VOA Special English Health Report. Dengue fever feels like a severe case of the flu, including pain in the muscles and joints. The World Health Organization says there may be 50 million dengue infections every year. Deaths are rare, fewer than 13,000 a year. But dengue has spread sharply since the 1970s. The disease is found mostly in cities. The WHO says 40% of the world's population is now at risk in more than 100 countries. Southeast Asia and the Western Pacific are the most affected. Dengue is also found in Africa, the Americas, and the Eastern Mediterranean. There is no vaccine against dengue and no special treatment. Scott Ritchie of James Cook University in Queensland, Australia, says control efforts target the mosquitoes that spread dengue. He says the only way to control it is through the use of pesticides, chemicals, and perhaps community education. But some mosquitoes are getting resistant to those pesticides. He and other scientists from Australia and the United States are working on a different plan of attack. They blocked the growth of dengue virus in mosquitoes by infecting them with a kind of bacteria called Wolbachia pipientis. Wolbachia is commonly found in fruit flies and is safe for people. The researchers released mosquitoes infected with Wolbachia into an indoor test area filled with uninfected mosquitoes. The infected ones mated with the uninfected ones and successfully spread the bacteria. The researchers then tried their experiment outdoors. Over a 2-month period, they released more than 300,000 infected mosquitoes in 2 Australian towns. Scott O'Neill at Monash University in Melbourne says the mosquitoes quickly infected wild populations just as they had in the indoor test. Once the release has stopped, the Wolbachia continued to increase until the experiments ended. Next, the plan is to do tests over the next 2 to 3 years in an area where many people are infected with dengue. The researchers described their work in 2 papers published in the journal Nature. Mosquitoes also spread malaria. The kind of mosquito that injects the malaria parasite into the people it bites is most active around sunset and sunrise. So bed nets can help protect people while they sleep. But the mosquito that spreads dengue, Aedes aegypti, is most active during the day. For VOA Special English, I'm Alex Villarreal.